Good morning. I will show you the final result from the SEMTiC history. The SEMTiC Trias is a first prospective single-arm multi-center history to evaluate the safety and the efficacy of the overall thrombectomy system for the stroke using three devices: the INEDIT, the INDEP, and the INTERCEPT patients with acute ischemic stroke. We use the INEDIT. The INEDIT is an intermediate balloon guiding catheter. We use INDEP, is a microcatheter, and we use the INTERCEPT as a stent retriever. All these devices are made in Spain by the eVascular company. We use all three devices, the INEDIT, the INDEP, and the INTERCEPT together like a tool. This is an example. This is a patient with occlusion of the middle cerebral, the inferior branch of the middle cerebral artery. And we put a guiding catheter, here the intermediate balloon catheter, the INEDIT, and after the INDEP microcatheter, and after we put the INTERCEPT stent retriever, and we inflate the balloon here in the intermediate balloon catheter, and I perform a mechanical thrombectomy and keep the TICI 3. Okay, what is the objective of this trial? Is to evaluate the efficacy and the safety of the three devices, the INEDIT, the INDEP, and the INTERCEPT, used together as a tool with a temporal restriction of the blood flow by the balloon. We had 175 patients in 18 centers, 14 in Spain, 3 in Germany, and 1 in Belgium, and we have external correlate independent. The primary endpoints, efficacy endpoint, was TICI 2B, more 2B, and less or 3 passes. The primary safety endpoints, the mortality from all causes within 90 days, and the main age was 75 years old. The median NAH score was 15. The median aspect was 9, and the occlusion was mainly located in M1, in the 63%. The successful reperfusion, the TICI more to 2B, was in 84%. The modification ranking score 0 to 90 days in 57%. We don't have any mortality related to these devices. The symptomatic cerebral hemorrhage was 1.4. The new territory embolism was in 4.3, and the infarction in a previous non-involved vascular territory was in 1.4. When we compare it with result with another trial, like the Hernes, Aster, Mohammed, and Aziz, we realized that the TICI, the successful reperfusion, the TICI 2B, more 2C, 2-3, was quite similar, not a statistical difference. The first pass effect was quite similar, and the mortality are 90 days, and the modification ranking score to 0 to 2 and 90 days were more similar, no statistical difference. In conclusion, the high success rates in reperfusion indicating a strong procedural efficacy, the good functional outcome and high neurological improvement observed in patients, the safety confirmation by low rates of symptomatic intracerebral hemorrhage and mortality, and these results support the use of eVascular devices. The INEDIT, the INDEP, and the INTERCEPT are safe, effective tools for treating acute ischemic stroke. Thank you very much for your attention.